My name is Sophia McIntyre, and I'm the Medical Director at Hudson River Healthcare. And my talk today will be on quality improvement, and the title is All Aboard Destination QI, a team approach to quality improvement. The objectives for today's lecture include the definition of quality improvement, identify targeted quality goals, assess areas of strength and areas of opportunity, identify the 7 components of a successful team, develop an integrated approach to quality improvement with action plans, define PDSA Cycle, and then identify principles of PDSA Cycle for quality improvement. So quality improvement. There are lots of definitions that many individuals may think about when they think about quality improvement. So here I'm defining quality improvement as a method of continuously examining processes and identifying systems for making them more effective. Patients are the key components in the improvement process. The goal of quality improvement is to eliminate inefficiencies and multiple modalities, specifically operations and clinical. And this is really important for quality improvement. So this is a pictorial of quality improvement, where patients should be your base when you're thinking about quality improvement. You want to decrease your inefficiencies with the goal of improving health outcomes, and that's really important. So let's talk about the next steps after understanding the definition of quality improvement. This represents a pictorial of quality improvement, and it's really a continuous process. Quality improvement should not be stagnant. It should be something that's constantly occurring. So let's start with quality improvement as the center focus. And the first component is identifying your goals, obtaining the data, analyzing your data, identifying your strengths, and identifying your opportunities. And as you see, the arrows represent a really fluid system where you're going from identifying goals to obtaining your goals, identifying your strengths, opportunities, analyzing your data, and then again going back to identifying your goals. And this is very important. So let's talk about the next steps. So identifying goals, obtaining the data, analyzing the data, and then identifying strengths and opportunities. And opportunities are really areas of weakness or areas of development. So these are specific areas that you really want to focus on and look at for improvement. So let's start with identifying goals of quality improvement. When you're thinking about quality improvement, it's important to understand, well, what is it that you actually want to accomplish? Do you want to look at improved efficiencies? Is it patient satisfaction? Is it improved health outcomes? It may be one, it may be both, or it may be all 3, or it may be something that's not even included in here. Are you equipped to make the changes? Because if you're looking at quality improvement, you're really looking at ways to improve what you're already doing to have some impact on health outcomes. So that hopefully includes a change, because it should not be business as usual when you're looking at quality improvement. So who is it affecting when you're making the change or you're considering the change? Is there additional training needed for you, your staff? And how will change affect the workflow? And these are really important components to think about. So I'm going back to the original diagram, and I'm going to focus on obtaining the data. So when you obtain the data, first of all, you have to first sit back and think about it. Do you have a method to obtain your metrics? So how are you going to obtain your data? Do you have electronic health record that allows you to get the data in the right nice spreadsheets or a list of patients that you need to focus on? Do you have the ability to track the data over time? Is this just one point in time you're looking at data, or do you have the ability to track your progress over time? And then what aspect of data will you like to focus on? What's going to be the emphasis? Is it on disease? Is it hypertension? Is it diabetes? COPD? Is it asthma? Is it childhood immunizations? And what aspect of the disease do you want to look at? Are you looking at the complexity of the diseases? So if we look at diabetes specifically, are you looking at all patients or patients with hemoglobin A1Cs greater than 9? Or if you're going to be looking at blood pressure, are you looking at patients that have blood pressures of 140/90 or greater? And time may be a consideration to look at. So are you looking at patients that were seen perhaps in the calendar year of 2010? Or are you looking at time in respect with patients that have not been seen in the office for over 3 months, 6 months, 9 months? Or are you looking at a combination of these things? Are you looking at diabetics that have a hemoglobin A1C of 9 or greater that have not been in the office for 6 months or more? So when you look at your data, you have to figure out what components of the data is important to you and you're willing to work on. And then when you're comparing your data, you want to know what your national and your organizational benchmarks are. Because I think if you're looking at quality, you want to be able to know, are you in line with what's already happening? So how do you know if this is an area that you want to focus on? If you're doing well and you're above national benchmarks, well, perhaps that's not where you want to spend your energy. Maybe you want to spend your energy in areas where you're not reaching national or organizational benchmarks. So then we look at the third component, analyzing the data. So now that you have the data, what are you going to do about it? And what do you want to look at? So first off, when you're looking at the data, you want to know, is the data accurate? Does it make sense? Or is the data that you're looking at reflective of what's really happening in your practice? Or are the numbers skewed? Because that may mean going back to the original reporting system that you have and reworking it to make sure that the information is mapping appropriately if you're using electronic records, or if it's a manual process, if you're looking at the information correctly. And the really integral component is sharing your data with your team. Quality improvement is not an individual process, it's a group activity. So when you're looking at this information and this data, you want to be able to share with your team. And this is crucial because you want to obtain your feedback from your team regarding the data. They are able to help and assist you in the quality improvement process if you're sharing that information. Often as providers, our counterparts, our teams, may have information that we are not privy to that can help us in the improvement process. So it's important that you're not working at vacuum alone when you're looking at this data. So now let's look at the next component, which is identifying your strengths. So you've had your data, you have analyzed your data, and now you're looking at information with respect to if you're doing well or if you're perhaps not doing as well. So I like to always encourage you to celebrate the successes, because with quality improvement, you first have to step back and say, you know what, we are doing some things right, and we should be happy and proud about it, and let's congratulate the team as well. So when you share your data, you don't only want to look at the areas of development or areas where you feel there's lots of opportunity. You want to say, you know what, team, we've done a great job with this. It may be your diabetic patients have all their immunizations for pneumovax and flu vaccine, but perhaps your diabetics are not all getting foot exams or eye exams. So you definitely want to celebrate where you're doing well and then talk about and strategize areas where you can improve. So congratulating your team is really important. And often when you're looking at quality improvement, sometimes this is an area that's overlooked. Now let's look at identifying opportunities. So these are the areas where you feel that you can improve. So often it can be overwhelming when you have all the information. So you've analyzed your data, now you have all the information with respect to your results. So now you have to figure out, well, what's going to be my focus? What's my priority? Am I going to focus on all diabetics? Am I going to focus on diabetics that have hemoglobin A1Cs of 9 or greater? Am I going to be looking at my hypertensives that have blood pressures of greater than 140 or 90? Or am I going to be looking at my diabetics that also have high blood pressure, that have blood pressures above 130 over 85? So you really have to identify what are going to be your priority areas. Now this can help you when you know and you understand what your organizational and your national benchmarks are, because you don't necessarily want to work on areas that you're doing well in. That would be a act of futility. So meeting and discussing with your team to brainstorm some areas of importance and priority. So when you're analyzing the areas of development or areas where you feel like you really need to improve, there are several components you need to look at and consider. Workflow, training, time constraints. So how are these priority areas going to impact your workflow? Are you going to require more time for patients with your nursing or your clinical staff? Do your current team members have adequate training to accomplish the goals that you wish to look at? Are you pressed for time with respect to time constraints? Many of us are being tasked to do more with less time. So how are these improvement projects really going to impact us and the time requirements or the time that we have? And that's really important when you're looking at it. So, all aboard, the train is arriving to the station and it's quality improvement time. So let's take a look a little further. Teams. So teams are the crucial component when you're looking at quality improvement. It's not just you, the provider. It's not just the nurse. It's not just the clinical assistant or the medical assistant or the front desk. It has to be a group effort in order for it to be really effective. So that's why when I reviewed the slides earlier, when I referred to sharing the data with your team, this is a crucial component, because often it's going to be your team members that are really going to help to follow through with your plans. So I like to look at this as combining the important elements of quality improvement. You have your data, you have your team, but at the core of it all, your patients are there. And your patients are the key component because you're looking at improving health outcomes with these quality improvement projects. So with these three components, your patient, your team, your data, your patients, you're looking at targeted goals for quality improvement. Seven components of a successful team I think are crucial when you're looking at quality improvement. Because if you're really taking on a quality improvement project, there has to be some ground rules for team members and some important factors to look at. So trust is a very important component in this process. Diversity, interrelatedness, having an openness to new ideas, having respect for your teammates, understanding that your teammates, that they're going to have varied interactions, and then really important is effective communication in any team component. So let's explore these a little further. So trust is seeking input. So when you're sitting down at the table and you're looking at your quality data, you want to be able to seek input from your clinical staff. They likely have information that you may not be privy to. And also you want to be able to trust your staff to carry out tasks. For example, if you're looking to improve pneumovax vaccination rates, then you want to be able to create standing orders. In order to do that, you have to have a trust that your clinical team will follow through with the criteria that you set up in order to implement this process. In addition, it's important to avoid the micromanagement. Many providers want to ensure that all aspects of care are being completed, but it's not possible with the many demands on our time for us to do everything ourselves. So we really do have to trust our clinical team and our support members to make things happen for us. Diversity, very important. So you want to encourage diversity in opinion, because this allows for an opportunity for your staff and your team to give you input that may be unique. This also allows for you to broaden your opportunities for varied solutions. So if everyone's like-minded, then that might be, you may be missing out on very important aspects of the quality. You want to stimulate learning. You want to have an environment where you're teaching your clinical team as well as your patients. And oftentimes when you're teaching your clinical team, you'll find out that they're more apt to follow through on demands if you're teaching them. Next component, interrelatedness. And this really just discusses a team member's understanding of how one's work affects others. So we don't work in a vacuum. We know that each of our team members are integral components for the success and for the improved outcome of our patients. So our nursing staff are just as important as our front desk staff. Our front desk staff are responsible for getting patients in, answering phone calls, and communicating some of the concerns or needs of our patients. Interrelatedness also focuses on understanding the contribution of one's work and how it contributes to the goals of the practice and the community at large. So what that means is that each team member are integral components, and each of their contribution is going to have an impact on the practice. So if your front desk staff is having a bad day and they're not communicating well with your patients, then that's going to impact how your patients perceive you as a provider and also as an organization. So it's important that when you're looking at quality improvement, you're focusing on all aspects of care for patients. Now, the next is openness to new ideas. This is crucial because if you're not open to new ideas, you may get stuck in a point where you're doing the same thing but expecting a different result. So you want to create an environment in which you encourage others to express ideas without fear or ridicule, criticism, or punishment. You want to create an environment that encourages learning and improvement. So it's important to have improved quality, but it's also important to have an openness to new ideas. Next is respect. And this should be intuitive that in order for a team to be successful, there has to be respect of all team members. You want to make sure that you create an environment that is considerate, that's tactful, and that's honest. An integral component is also, respect is an integral component when you're in challenging circumstances. So when things are not going well, having a respectful environment, having the ability to be honest with your team, to be able to communicate what's happening in real time, and not be afraid to provide that candid feedback as it's necessary so that you can realign your team to meet the needs of your patients. Now, it's also important to have a varied interaction. So what does that mean? So in some office settings, there may be more of a social environment where all team members not only work together and complete tasks, but they also have time together outside and more of a social interaction. And this can be helpful when you're asking team members to multitask and to really work cooperatively with one another. When there's a stronger connection outside of a work environment, this can help to improve quality. But there also must be a balance in which that there's a task-oriented interaction as well. So what that means is you want your staff to get along well with one another, but you also want them to be task-oriented in their interactions with one another. And being social and task-oriented is not mutually exclusive. These are really distinct components. 7 components of a successful team also includes effective communication. And communication is an area of development for many organizations and providers. So when effective communication, what does that really mean? So it's an environment in which there's a balance of real-time communication and also communication that is not real-time. So these are broken up in 2 components, rich communication and lean communication. So rich communication is that face-to-face interaction when you really want to convey something that is really important, that may be emotional, and also in instances where you want to ensure that there's no misunderstanding about what's being communicated. Lean communication is a vehicle which allows for information to occur that's not in real time, and that is either through emails or memos. And this is most appropriate for routine messages. Certainly, lean communication is not appropriate for urgent matters. For example, if there are a critical lab that is that you want a patient, a clinical person to act on, you wouldn't send an email or memo about that. Clearly, that would be a face-to-face communication or telephone communication. And not all correspondence have to be in real time. Real time would be the ideal, but obviously with time restraints does not always allow for that. Now, when we're talking about quality improvement, it's important that when we're looking at our teams that this is an integrated approach. So these 3 pictures represent 4 individuals in each component putting the important pieces together in order to reach an outcome. So an integrated approach is really important for quality improvements. So let's go over some ground rules for developing an action plan. Because I think that when you're thinking about quality improvement, you have looked at the data, you've identified your strengths, you've identified your areas of development, and now you've sat down with your team and talked about what your areas of priority are. So now the important part is let's lay some ground rules in terms of developing an action plan. So one important component when you're sitting at the table to identify what the plan moving forward is for quality improvement, you want to make sure that there's equality among teammates. So providers often are directing quality, but when you're really looking at an action plan, you want to make sure that everyone feels like they're on equal ground, that there's not one team member that is more important than another team member. So it's integral to know that each member is a vital piece in the puzzle. Additionally, there should be an adaptation of the 7 principles of a successful team. So those 7 principles which I reviewed, it's important that each team member is actually focusing on those principles. So the development of an action plan should be a shared responsibility. So it's not just the provider that's coming up with the action plan, but it's the nurses, the clinical staff, and even the front desk. Your front desk person may have some great insight about what may be some challenges that may be contributing to some of the areas where you're not doing well in. An example, if you have a patient that your diabetics don't seem to keep their referrals for their ophthalmology or the podiatry appointments. Your front staff may have some insight on why that's happening. It may be that the patient is leaving the referral papers at the front desk and forgetting to take them with them. It may be that your patients don't really understand where to go for their referrals. And that might be communicated via the front desk, because the front desk staff may notice that there are a lot of questions when patients are leaving the room. So it's important to really look at all aspects that may be contributing to the development of your action plan. So let's talk about implementation of your action plans. And this is a nice pictorial of your action figures, because I think that this should be more of a fluid process when you're implementing action plans. This should not be a passive process. So just like our superheroes, they're not sitting back waiting and looking for things to happen. They're making sure things are happening as we should be. So let's look at the use of the PDSA cycle for practice transformation. So patients are at the core of quality improvement. There should be an integrated approach, and then the PDSA, and then this is carried through the PDSA cycle, which is the cycle of change, or the cycle for practice transformation. So let's first describe what PDSA is. Plan, do, study, act. So the first component, plan. That's a shorthand for testing a change by developing a method to test the change. Do. You're carrying out a task. Study. You're observing and learning from the consequences. Act. You're determining what modifications should be made for the test. So this principle is used in many organizations, and this allows for quick examples of change to be implemented. So this represents more of a continuous cycle for PDSA. So we'll start with plan. When you're planning a project, you need to identify what your goals are. Do you want to target all patients? Is it diabetic patients? Is it diabetic patients with hemoglobin A1Cs 9 or greater? And then you want to be able to plan how to carry out the cycle. So who are your patients? What is the disease? Where is it going to be an office focus? Is it going to be a community focus? And when do you want to do this and implement this plan? Do is actually carrying out the plan for improvement. And when you're doing it, you're identifying, in this process, you're identifying challenges and unexpected findings. And that's what's part of the PDSA cycle. You're looking to see what are some barriers to improving your quality improvement. You're initiating data analysis, and then with your study, you're completing the data analysis. You're analyzing the data to compare to targeted goals. You want to compare yourself as a provider to your organization, or even to maybe national benchmark. How do you compare? Is there some areas that can be improved? And as you're completing the data analysis, you're really summarizing where you are in patient care and improvement. When you act, you want to identify if there are modifications needed. Is there a change in workflow? Are you going to huddle with your staff before each patient comes in? Is your staff going to look at your list of patients 1 or 2 days before patients come in? Or is your staff going to obtain a list of all your diabetic patients and find out if they've been into the office or not? And if they haven't, are they making calls to get them in? And then if after doing that, you're going to your next cycle of change. So plan, do, study, act is a fluid process. It's continuous. And it doesn't mean with plan, do, study, and act, it may not be that it's one component that's being looked at. It may be that you have multiple PDSA cycles that are going on at a time. So what are some core principles for quality improvement? Flexibility, adaptability, enthusiasm, critical progressive thinking, sustainability, and consistent communication of plans. So when I think about flexible, when you're looking at a PDSA cycle, it's crucial for not only you as the provider, but for your team to be able to understand that it may not be business as usual. You may have to change how you've normally operated in order to achieve quality improvement. This flexibility may be in one instance, or it may be something that changes regularly. It's important to be able to be adaptable. So maybe your quality improvement requires that you change your way of rooming patients. It may be that you change the way patients are getting their blood work done, where they're getting their referrals. It's important that your staff is going to be flexible to some of those changes. And as a provider, I think it's crucial for you to be enthusiastic about this process. Sometimes quality improvements thought, oh boy, here we go. What else do I have to do? If I have enough to do, why should I be doing something else? So enthusiasm can be contagious. So hopefully you as a provider, you have that enthusiasm to spread to your team. And also it's critical that you have a progressive and critical thinking. So progressive meaning that an openness to change your normal practice styles. Open to the possibility of doing something completely different. So maybe your patients, when they first come into the room, they're not just seeing the medical assistant. Maybe they're going to go to the lab first and get their blood work drawn. They're going to then come in, get their vaccines, and you're the last person that comes into the room. And maybe that you've had your patients come in, see you first, you put in orders to your nurse, and then to your lab person, and then they leave. You may identify some inefficiencies in the system, so it's important to be able to be progressive when you're looking at a PDSA cycle. Now, as you look at your PDSA cycle, you should also be looking at your sustainability. How can I sustain what I'm doing well? And I have in red the consistent communication of plans. This is critical because often there's many assumptions that we make when we're providing care. And this assumption may be made with not only our patients, but also our team members. So we need to communicate consistently this plan for our PDSA cycle to not only our patients, but also to our entire team. So that means including your front desk in the quality improvement projects. Letting your patients know, we're trying something different. I want your feedback in this process. Let me know if this is working for you as well. So communication is really paramount as well. And here I'd like to look at some workflow principles for PDSA cycles. You need to act on your ideas. So you've gone through the whole process. You've identified your goals, you've analyzed your data, you've identified your strengths, your weaknesses. You've now come up with an action plan on what to do. So now, don't just keep the information, but act on the ideas. You need to be able to identify some timelines. So how soon do we want to work on these plans? Are we going to try this cycle of change for the first month? Are we going to do it for 2 months? Are we going to do it for 3 months? And at what point are we going to reevaluate the success or the lack of success in our PDSA cycle? And often it's important to minimize resistance to implementation. So you've put this work together, you've decided, and your team has decided that we want to work on improving our quality. Or maybe it's something that your organization or your medical director or your chief medical officer says, look, we're starting a new quality improvement project, and this is what we're going to do. So hopefully you're open to change, and also that you're not resistant to this. And that sort of goes back to some of the core principles of having that enthusiasm as well. You want to keep it simple. So if you're doing a PDSA cycle, you may not want to do 5 different things at a time. So if you're looking at diabetics, so maybe you're not going to focus on their ophthalmology referrals, the podiatry referrals, or nutrition referrals. Maybe you just want to focus on getting them to take their medications. It may be something simple as that. Or it may be that you just want to focus on improving their adherence to their medications. It may be that you want to look at them keeping their appointments regularly and logging what their glucose logs are. So you really want to keep it simple. And as you're going through this process, you want to collect feedback on your performance. How am I doing? Is this working for you as the patient? Is it working for your team members? Are you tasking them to do things that are beyond their scope of practice or beyond their level of training? You want to be able to conduct regular meetings so you can provide that and obtain that feedback on the performance. So this regular meeting should happen, it may be weekly, it may be daily, or maybe monthly, depending on the extent of your PDSA. During these meetings, you should be clarifying the goals and the roles of each individual as they are participating in this process. And again, I have keep it simple, because I can't stress it enough that it's important to keep it simple. And lastly, as part of your workflow, again, consistent communication. So if patients now are being roomed in a different manner, you want to make sure this communication is fluid. So that means your front desk person is letting them know, we're trying out a new practice. We're trying something different. So your patients know when they first enter the office that this is something new and perhaps different from what they've experienced. And this is then communicated to your nurse or your medical assistant as they're rooming the patient. And then when you come in as a provider, you're also letting them know, we're trying something different. I want your feedback on it. Let us know if this has helped, this has improved their efficiency, or if you find that this is not helpful. Consistent communication is always the key. Now lastly, when you're looking at sustainability, I think it's important to look at 12 factors and framework. And this comes out of Sustaining Improved Outcomes, a toolkit. So with sustainability, you're looking at a 12-factor framework. Do all of your team members understand the value, the perceived value of this quality improvement? So you may find that as you're implementing a PDSA cycle, it doesn't seem to work. And you may have to step back and say, well, does my front desk staff understand the importance of this project? Have I communicated how this is going to impact the care of patients long term? Have I provided feedback and monitoring? Is there leadership engagement, not only from you as the provider, as the leader, but is there engagement of leaders? So that includes your administrators, your chief medical officers, and it may even include your chief executive officer. Are they engaged in this process? Is there staff training that's needed? Can these PDSA cycles and cycles for improvement, have you looked at training? Has it been sufficient? Are you asking and tasking your staff to do things that are beyond their scope? That's important to look at for sustainability. Using shared models like PDSA cycles are also crucial in this framework. Have you looked at the organizational infrastructure? Are these areas of change and improvement, are they fitting into the normal culture of the organization? Are you able to focus on this fit in a very fluid way? How is the community impacted on this? And this community could be the outside community or the community of the organization. Have you aligned partners with this process? So not only are your team members your partners, but your partners could be outside the doors of your office. It could be the community at large. It could be other partnerships. And are you able to spread these quality improvements beyond your site? If you're located in an organization that has maybe multiple sites, are you able to transfer these ideals and these practices to other sites? And I've included my resources for quality improvement. So I guess the take-home message is, with quality improvement, it should be a shared responsibility. There should be constant monitoring feedback and a fluid communication.